Usually by the time I see a patient that has severe burning mouth or burning tongue, they've already seen a dentist, they maybe have had some dental work, they probably have already seen like an endodontist or an ENT doctor. So just realize I'm seeing somebody where there isn't a dental cause or an ENT cause, and then somebody comes to Caring Medical, the Hauser Neck Center here in Fort Myers, Florida. Burning mouth syndrome is a condition where you have severe pain all the time in the mouth or in the tongue, and usually it's the whole area. Occasionally it'll be more on one side than the other. I've even had patients where it was just horrible burning on the tip of the tongue. And according to Hauser's law number 2, if the etiology of a condition is not known, if you follow the neurology will lead to ligamentous joint instability. So the first thing when you have a chronic symptom, say somebody has terrible burning pain in the mouth or the tongue or the tip of the tongue, what's the nerve supply to that area? So the nerve supply of sensation in the mouth of the tongue is the trigeminal nerve, and that's what you see here. Now the trigeminal nerve is not taste. Like if somebody has altered taste, that's a different nerve. That could be cranial nerve 7 or cranial nerve 9, possibly even cranial nerve 10, the vagus nerve. But as far as like, you know, if I take my finger and I can feel my finger on my tongue, that's the trigeminal nerve. A lot of people don't realize cranial nerve 5 or the trigeminal nerve does sensation not just in the mouth but in the face, even the eye, you know, the actual sensation. Like if you have my eye and I can put pressure here, the sensation of that is actually the trigeminal nerve. And there's a tract called the trigeminal cervical nucleus. See that here? The trigeminal nerve has some connections with cranial nerve 1, 2, and 3 in the upper cervical region, and that nucleus tract is called the trigeminal cervical nucleus. What it means is that if a person has upper cervical instability or has irritation of the C1 nerve, which is between the occiput and the C1 vertebrae, or the C2 nerve, which is between the C1 vertebrae and the C2 vertebrae, and possibly even the C3 nerve. If you have irritation of those nerves, it can then stimulate the trigeminal nerve, and anywhere on the trigeminal nerve tract you can get symptoms. When somebody has a stable cervical curve and they have the normal cervical curve, it's much more likely that the trigeminal cervical nucleus, all the neurons in that tract are going to function normally, and then you just have normal sensation on the face, the eye, the mouth, the tongue. Now, when there's irritation of the trigeminal nerve, you can get a lot of symptoms, not just severe lancinating pain in the face that is horrible, that we know is commonly referred to as trigeminal neuralgia. There's many atypical syndromes or unusual symptoms that can come from trigeminal nerve dysfunction, such as hemifacial spasm, burning mouth syndrome that we're talking about, atypical facial pain, eustachian tube dysfunction. Over the years, I've had many patients with tensor tympani syndrome, myoclonus, which is where the person, you know, can hear and feel that there's a muscle in the inner ear just keeps going, you know, pounding. Trigeminal dysphoria is where, similar to text neck syndrome or computer vision syndrome, where there's trigeminal symptoms, there's severe headaches, there's blurry vision. That can also be from trigeminal nerve dysfunction. Then typical trigeminal nerve neuralgia, where there's lancinating electric shock type pain. What's not on here is just eye pain or a gritty sensation in the eye. If you go on the internet, you'll see that, wow, dry eye disease is just rampant, and one of the causes of that, which I'll do a future video on, which is trigeminal nerve dysfunction. Now this is when somebody has ligamentous damage in the upper neck leading to ligamentous cervical instability or ligamentous upper cervical instability, which we document by digital motion X-ray. You know, where we do a video camera of a person moving different motions, and we see that there's excessive movement of the upper cervical vertebrae because of ligamentous damage. This can then pinch on or compress, stretch and compress the jugular vein, the vagus nerve, and ultimately you get irritation in the upper cervical spinal cord, which leads to stimulation of the trigeminal nerve and can lead to various unusual symptoms of trigeminal neuralgia. So that's one method of ligamentous cervical instability causing burning mouth syndrome. Another one is where you get a block of the internal jugular vein that will increase the venous pressure in the head, which leads to the cerebral spinal fluid not being able to get out of the head normally, and the cerebral spinal fluid can then go on any of the cranial nerves, including the trigeminal nerve. So when someone has a cranial neuralgia, you know, a nerve irritation of any of the cranial nerves, and there's 12 cranial nerves, one of the possible causes is a blocked internal jugular vein. And the way that we document this at the Hauser Neck Center is we actually do ultrasounds of the internal jugular vein in the upright position, the laying down position, different kind of head and neck positions. And often we find that the compression of the internal jugular vein is at the atlas. Now, why all this is important is because you can actually do something about it. Because if this is causing the burning mouth or the burning tongue, if you correct the cervical curve, if you stabilize the upper cervical region with prolotherapy, then what should happen is the internal jugular vein opens, there's less irritation of the upper cervical nerves, and then there's normal functioning of the trigeminal nerve. Now this is a good anatomical figure where you see that you have the nodose ganglia of the vagus nerve, you have the superior cervical sympathetic ganglion. The C1 nerve is going to be over here, the C2 nerve's over here, the C3 nerve over here. And this just shows that there's an interaction with all these various nerves. And if these vertebrae are moving excessively, any of these structures can get affected and cause various symptoms, including burning mouth. Now this is a pretty detailed figure, but in the end, it's basically, we find that there's 5 main structural abnormalities that people have. Now the one we're talking about today is ligamentous upper cervical instability. But when you have ligament damage of the neck, it can cause a breakdown of the cervical curve, which is called cervical destructure, which can block the jugular vein, which can irritate the trigeminal cervical nucleus. And sometimes the blocked jugular vein is also related to the mandible. Like if somebody has really bad TMJ or horrible posture, that can block the jugular vein, and that's what's documented here. And then sometimes too, people will have elongated styloids. So if you're somebody who, when you sleep on your back and you have pillows behind you, and your symptoms are horribly worse at night, it could be that you have elongated styloids, and the way that we document the elongated styloids is by upright cone beam CT scan, and then we test whether the jugular veins are getting compressed by flexion, because the styloids run here, so flexion would make the jugular veins get compressed more in flexion. So then obviously that particular person, we'd have them get their computer up, we'd have them sleep in a position where the jaw is away from the neck, which would open up the jugular vein. And then to document mandibular malposition, again, upright cone beam CT scan will give the three-dimensional anatomy of the mandible. And then we test the jugular veins, or we could test the jugular veins with any kind of mandible position. Like we could have the person go to the side, protracted. So, and then we look at, is the jugular vein getting compressed or not? And sometimes it's actually the mandible. This kind of explains that when someone has, like for instance, somebody who comes to us who has burning mouth syndrome, again, you follow Hauser's law. Hauser's law, if the neurology goes through the neck, like the trigeminal nerve, vagus nerve, the cranial nerves, then there's likely present ligamentous cervical instability that's actually causing the symptom. So if there's a cervical misalignment, we can alter the person's posture. They can get upper cervical adjustments by an upper cervical chiropractor. If there's ligamentous cervical instability, initiate prolotherapy. Prolotherapy is an injection technique that stimulates the body to repair painful areas. It causes the tightening of the ligaments, and the tightening of the ligaments is documented by subsequent digital motion x-rays. So in other words, if somebody has, with flexion, they have the one vertebrae goes more forward than it should from another vertebrae, you can retest the person after several prolotherapies to see if there's progress in resolving the ligamentous cervical instability. And if somebody has a bad cervical curve, like a reversal of the cervical curve, we'll give them various exercises and things to do at home to correct that. Here's some clues that the problem is not actually in the person's head, but it's in their neck. Because often patients will tell me and the staff that they've been to other clinicians and they emphasize that maybe the person is an anxious person or a depressed person, and that's why they have symptoms. Let's agree that if a person's anxious or depressed, they may have more symptoms, but if somebody doesn't, if they don't have a history of being anxious and depressed, then you get burning mouth. It's unlikely that the burning mouth is from anxiety or depression. There's another cause. It's just that the clinicians they saw before just don't know the cause. So here are some clues. Like if somebody has clicking, popping, grinding in their neck, and then they have some awful symptom like dizziness, migraine headaches, burning mouth, there's likely a ligamentous injury in the neck. Like when I just did that, my neck isn't clicking, popping, grinding. Somebody who has neck pain, right? It's not normal to have neck pain. So if somebody has neck pain, it's likely that the muscles are tightening, and that's what's given the pain. Well, the muscles are tightened or spasming because there's ligamentous cervical instability. So when there's ligament damage through the ligament muscular reflex, the body will clamp down the muscles to stabilize the loose area. So it's not normal to wake up every day with back pain or neck pain or spine pain. These are signs or symptoms that likely there's an underlying problem causing the muscle tightening, which is ligamentous, lumbar instability, ligamentous cervical instability. If somebody has burning mouth and they have all the signs and symptoms, or some of the signs or symptoms of ligamentous cervical instability, bloating, problems with memory, shortness of breath, difficulty swallowing, headaches, poor digestion, dry eyes, dry mouth, inability to relax because of their vagus nerves are getting degenerated, it's likely that it's a ligamentous cervical instability problem. And most people come that no one's actually looked at their neck. So we do a testing called neck vitals analysis, where not only do we look at the structure, but we look at the pathophysiology that abnormal structure could cause, such as elevated eye pressure, fluid around the eye nerve, jugular vein compression, a decrease in the cross-sectional area of the vagus, and even arterial blood flow studies through the neck, and we find just all kinds of abnormalities. If you have burning mouth syndrome, burning tongue syndrome, and don't know the cause, just know that the cause could be related to your neck through the trigeminal cervical nucleus.